Greetings to all. And thank you for joining us today and for your interest in our latest NTD technical update of the MMDP project. My name is Zaina Sifri, and I am the Senior Technical Advisor on the MMDP project. USAID's Morbidity Management and Disability Prevention Project is a 5-year project led by Helen Keller International with a goal to strengthen the capacity of MMDP systems by working in close partnership with local governments and the global community to share knowledge and research on lymphatic filariasis. Today, we have the pleasure of discussing an exciting training package on LF morbidity management developed by WHO-ESPEN and an esteemed lineup. But first, we wanted to go over the sequence of the webinar today. We will start with Dr. Jonathan King from WHO, who will be opening up the discussion, followed by the rest of the presentations. At the end of the presentations, we will have a question and answer session. And we ask that those of you who have questions, send your questions in writing during the presentations using the chat box that you have on the GoToWebinar, and select to the organizer so that we receive the questions directly. The questions that we will not have time to answer will be compiled into a Q&A document that will be shared with all. After the webinar, you will receive an exit survey that we ask that you kindly complete and send back to us. All registered participants will also be receiving via email a link to the recording of the webinar and a copy of the presentation. Our distinguished lineup of presenters today includes Dr. Jonathan King. Dr. King is the focal point for lymphatic filariasis elimination at WHO's Department of Neglected Tropical Diseases in Geneva. He will be talking to us today about this exciting LF MMDP training package from WHO in the context of the Global Elimination Program. This will be followed by a presentation by Dr. Charles MacKenzie. Dr. MacKenzie is the current chair of the Global Alliance for the Elimination of Lymphatic Filariasis, also known as GAELF. He's also the Senior Technical Advisor for the Task Force for Global Health with the Neglected Tropical Diseases Support Center in Atlanta. He will be presenting the GAELF perspective on the importance of LF MMDP interventions in the elimination of LF. Next will be Ms. Caitlin Worrell. She's an epidemiologist with the Division of Parasitic Diseases and Malaria at the U.S. Centers for Disease Control and Prevention in Atlanta, and she will be providing a detailed overview of the different components of the WHO LF MMDP training package. Dr. Suma will be next, and she is currently a professor in the Department of Medicine at the Government TD Medical Hospital in Kerala, India. Dr. Suma will be presenting her own experience in using this tool in the Asian context and will present some background information on its inception. And last but not least is a presentation by Dr. Didier Bakajika. Dr. Bakajika is the Medical Officer for Onchocerciasis and Lymphatic Filariasis at the Regional Office for Africa for the World Health Organization based in Congo with the Expanded Special Project for Elimination of Neglected Tropical Diseases. Dr. Bakajika has been responsible for the African experience in using this training package with some recent workshops in 2017 and 2018 that he will be talking to us about today. And this builds on the experience that Dr. Suma had in Asia. Just as a note, we apologize in advance for any technical difficulties we may encounter during this webinar, as the presenters are calling in from different parts of the world. Without further ado, I would like to call on Dr. Jonathan King to talk to us about this new training tool.
Okay, excellent. So again, thanks Zaina, and thanks for this opportunity to talk about this new product that we have developed together in a collaboration. I think it's a model kind of collaboration in how we put this together and the time that we've taken to to develop and evaluate and revise. So if you all know, next slide please, why we are here and why we do this, we know that we have a global commitment to eliminate LF as a public health problem, signed off by all the member states in the World Health Assembly. And WHO launched the global program to eliminate lymphatic filariasis with two main aims. Of course, we want to stop transmission with the recommended strategy of mass drug administration. But our focus here is also on this second and just as important aim, and that is to address suffering and aim to improve the quality of life of persons with lymphedema and hydrocele due to LF, and WHO recommends a strategy of morbidity management and disability prevention. Next slide. The target of that second aim is to have 100% geographical coverage with the recommended basic package of care. So this is the recommended basic package of care by WHO. And it means that health facilities in every district with known patients must be able to provide treatment for acute attacks, management of lymphedema, management of hydrocele, and providing antifilarial medicines to persons who are infected. Next slide. Additionally, when a country has progressed through the program, through MDA and implementing MMDP, when they go to claim that they have achieved elimination as a public health problem, there are certain documentation, certain indicators that they will have to provide and document in the validation dossier to achieve or to obtain this acknowledgement from WHO. And there's three main areas. One is the countries have to know the disease burden. So, and that means estimates of the number of lymphedema and hydrocele patients at the implementation unit level. Secondly, they would have to provide documentation of availability of MMDP services. So the number of facilities providing services for the IUs with known patients. And finally, a documentation of the readiness and quality of the care that's being provided. And this is in a preferred assessment of at least 10% of designated facilities. Next slide. Now, why do we need this training package? Well, I've only been at WHO for now just over 4 years. And nearly from every meeting, whether it's a regional program review group or program managers meeting, there's always requests from the member state of how do we do MMDP? How do we scale up? We're making progress with MDA, but we need help in scaling up morbidity management. This slide also shows kind of a gap. As of 2016, there was a gap in the countries reporting this data. So if we're going to ask this in the validation dossier for countries to report on those three indicators, there was a lot of work to be done. So we need something to help provide guidance for the countries. Now, this was 2016. You'll see in the presentations that there's been these regional workshops, and I expect that there's going to be a migration of countries in those red and yellow boxes all the way into the green. So the green is going to get really fat, and this is going to be very exciting. Next. So because of this demand from the countries, and for this helping countries document the requested indicators for the dossier, we developed this, we saw this need, and we developed together in collaboration with the MMDP project and Professor Suma at TD Medical College and CDC and others to develop this training package that could be delivered, could be standardized, similar to the TASK training package that we have for implementing the transmission assessment survey, but we would do this for MMDP. Next. Now, the package actually aims to help the countries do four main things, and obviously there's, I think there's more benefit beyond the four things, but the main thing is to strengthen the national NTD program capacity, So provide a clinical understanding and practical training on the recommended care, and help the countries in the capacity to plan, monitor, and report on morbidity management. It is intended to help the countries understand the MMDP requirements for validation. We also provide the opportunity to review tools and methods through practical exercises that will enable the countries to generate some of the information that's requested here. So assessing the current situation, this is situation analysis, estimating the number of patients. We review various methods of patient estimates, and assessing the quality and determining the strengths and weaknesses of the care available. There's also a tool that's discussed that would help countries plan and implement quality assessment. And finally, there's a country working together, a time for members of a national program to plan the scale-up of the recommended care. And again, within the primary care system. MMDP is not intended to be implemented from the NTD program in the Ministry of Health. WHO is not recommending that this is happening. We recommend that the primary healthcare system is strengthened in order to deliver this ongoing care. It's the only way that it can be sustainable. Next. As you all are aware, SDG 3.8 talks about universal health coverage, and this is the big agenda item in most of our governments, and discussion in regional health meetings among governments, and that is, providing people with access to quality essential healthcare services that they need, so leaving no one behind. Well, morbidity management has a recommended basic package of care targeted to those affected with the disease, which we know that persons with LF tend to be some of the most marginalized populations in our countries. So therefore, MMDP, and it's our responsibility to highlight that MMDP is a step towards providing this universal health coverage. Next. So the next steps on the training package, we have it fully developed, and you'll see how we develop this over the course of 3 training workshops, 3 regional workshops. At the WHO side, we have this. We have English and French translations, but we have to go through the final publication clearances, working with our communications capacity building team to finalize the layout and the web packaging. Once we do that, we'll have a public dissemination of links and probably a web release on this. And so we don't intend just to make the materials available, but I think we will continue, given the positive response from the regional workshops and some national workshops that have now been conducted in response to the regional workshops, is to expand this, continue doing these a few each year. So, next slide. So with that, thanks very much, and I turn it over to the next speaker.
Thank you very much, Jonathan, for this excellent presentation. Dr. MacKenzie, you're next.
Thank you, and welcome to everybody. And I would like to give a few comments to follow on from Dr. King in relation to the global program, and really give you some indication of why it's so important that we do carry out the MMDP part. Have the next slide, please. I don't. Thank you. So we actually have an LF program because there are patients. So patients are central, and interrupting parasite transmission really stops us having any more disease. That's really the aim of the program overall. And LF patients, therefore, are ultimate criteria of our measurement and really the central reason. The typical picture most of us have of an LF patient is one with lymphedema or with hydrocele lymphedema, as you can see here in this picture from Tanzania of Sultan, who has lymphedema. But we need to remember that this is only, these two presentations, lymphedema and hydrocele, are really only two of the changes that go on inside somebody who's infected. And most importantly is that it affects children at a very young age. So it's very important that we carry out our prevention and treatment at an early age, because as time passes, you get internal changes, which include some very serious ones that we often forget, such as kidney damage. So it's very important to start our programs for MMDP as soon as we can. Next slide, please. Now, as Dr. King has said, the global program has an MDA section and a pillar of MMDP. And the important things, as he has highlighted, are this minimum package of care, the preparation of the dossier where we record all the actions and successes that have taken place in that care package distribution, and then under the green arrow, the very important integration of long-term care into the health services. At the next section. Next slide, please. So just a few comments about actually carrying out MDP from experiences across the Global Alliance. It has been found that it's really important to link patients to MDA. We've tended in the beginning to separate the two, but the more that they're linked, the better the overall program is. People actually take the drugs because they want to avoid having that horrible disease that they've seen in the patients. These are the people who are not affected, have a fear of developing the disease. Seeing improvements in patients actually enhances MDA coverage. That's been found in programs, in the Tanzanian program and in others. So seeing patients being taken care of and seeing that patients are improving is a great advocacy tool for the overall program. So wherever you can, see if you can link the two programs together, the two pillars of the program together. Next slide, please. As discussed in the seminar, there are a number of information sources to help you to put the program, of the MMD part of the program, together. And as Dr. King and others have talked about, or will talk about in the seminar, there's a great training package that is becoming available. Don't forget that there are other sources because a number of countries have already been carrying out with their NGO partners MMDP for some time. And the Global Alliance also has links to publications and packages, and will have more over the next year. There are also people who are expert, like Dr. Suma and others, who you're free as country programs to contact and get support from. So the WHO package is obviously central for you to look at and use, but remember there are other sources for help. There's also a training tool, the HKI Fast Hydroselectomy training tool that is available to help in training. So there is much information available now, so please ask and contact us, particularly in the Alliance. We can help you link to these information sources. Next slide, please. So in carrying out MMDP, there are some challenges that we've seen across the Global Alliance that I would just like to highlight for you so you are aware of them. As Dr. King mentioned, we need to know the burden. Finding patients can be a challenge. This is a disease that people carry stigma and do not want to be identified often. we've found that using the local health workers, the primary healthcare system, is a very good way of finding where the patients are and therefore getting them access to care. So the local health workers are a very good link when you're trying to estimate your burden. There's also the possibility here of linking with MDA in trying to find where patients are. But remember, once you identify a patient, you really need to be able to provide care for those people. So you need to remember that in terms of identifying. The quality surgery, some of the challenges that have been seen, there are some needs to get optimal techniques, ensuring that every surgeon is aware. It's often good in your countries to go through your surgical societies to get out the information related to LF hydrocelectomies. One of the issues we found is that following up patients after surgery, which is essential to do, can be a difficult thing to do and can be expensive because you need to find patients probably out from where they received their surgery. And remember, record your activities. The dossier for your presentation to WHO is important to record everything. And the last challenge I'll mention here is the long-term care for lymphedema. And this is something that needs, as Dr. King mentioned, to be carried out hand in hand with the primary healthcare system in the country, the ministry system. And maintaining supplies for the long-term care can be a challenge. I would point out that there are some cases of lymphedema and hydrocele that are complicated cases. By that I mean severe lymphedema or hydrocele, very large hydroceles, but patients have other problems such as diabetes, obesity, and hypertension. These need care by experts and are not really to be cared for at the periphery. So next slide, please. So last point I want to make is that one of the things we need to do is to celebrate successes. The dossier is where a lot of the successes can be described. Obtaining numbers is important to describe the success of the program, and in the WHO package there are instructions how to gain numbers. Reduction in cases is something that's important, and you should always look at the fact that the number of cases and new cases is being reduced. The importance of universal healthcare has been mentioned by Dr. King, and that's an important aspect to describe in terms of success. So in summary, what we're trying to do is clearly define and describe a medical care support system that's accessible and available to all F programs. And if we do this, and the last slide, sorry, yes, we will attain our global goals of no new cases, and those who are affected are cared for. And in Tanzania, we have used the phrase, no child born after the program will suffer this condition. And that is something that we've been a goal for the program and the global program. So thank you very much. I'll end here.
Thank you, Dr. MacKenzie. As a reminder, you can write your questions in the chat box and send them to the organizers. Ms. Worrell, you're next.
Thank you very much, Zaina, and hello to everyone on this call. So this morning in my time, I'm going to be giving a brief overview of the WHO training package on morbidity management and disability prevention that's been mentioned by both Dr. King and Professor MacKenzie. So this workshop is a 4 to 5 day training workshop, and we found that what makes the difference between 4 and 5 days is usually the number of participants. And as Dr. King has already mentioned, the purpose of this workshop is to strengthen country capacity to implement the clinical and programmatic aspects of MMDP for lymphatic filariasis. And this workshop is aimed at program managers, clinicians, and monitoring and evaluation specialists. So this workshop comprises 3 main content modules. The first one is background on the global program to eliminate lymphatic filariasis. The next one is exploring clinical components of LF-MMDP. And the third is exploring programmatic components. So to make this workshop accessible to all learners, the workshop uses a variety of learning strategies. It starts out with a standardized set of PowerPoint presentations that goes through all of the key concepts of morbidity management. So to help the participants then develop and refine the skills that they learned during these presentations, throughout the workshop we have a variety of group work and case studies. One aspect that is critical to the success of this workshop is patient interaction. So participants have the opportunity to work with persons who are living with the disease. Throughout the training workshop, there's also an important component of countries sharing their experiences with one another. And then finally, a substantial amount of time of this workshop is dedicated to practical exercises that let countries use their data and to create a country work plan. So the first module explores MMDP in the context of the global program to eliminate lymphatic filariasis. And here you'll see a framework, the GAELF MMDP framework. And this framework is really what anchors the next 2 modules and aligns all of the key clinical and programmatic components. The second module explores some of the key clinical components that comprise the minimum package of care. Module 2A starts with an introduction to LF clinical disease, and this outlines key components of LF pathophysiology that are relevant contexts for understanding clinical management. Module 2B allows the assessment of patients for lymphedema and hydrocele and includes standardized staging strategies. Module 2.3 goes over the components of the WHO minimum package of care and goes in specifically to strategies on managing acute attack. Then Module 2D goes into the management of lymphedema with a particular emphasis on the 5 basic lymphedema management strategies outlined by WHO. 2E provides a brief introduction to hydrocele management. And it should be noted that participants are not expected to leave being able to conduct hydrocelectomy. There's a separate surgery training for surgeons, but this is just a brief introduction. And then finally, a critical component is an introduction to the psychosocial aspects of care. As part of the clinical module, there is a clinical practical session. And this is at least a 1-day practical session where the participants are able to apply all of the knowledge that they learned in Module 2 while working with patients. There's at least 1 master training at each workshop who's able to demonstrate how to conduct a patient assessment and how to perform lymphedema management. And what you'll see in the pictures here on the right is that participants work in cross-country teams to practice these skills. And one incredibly powerful and emotional component of this clinical practical session is an opportunity to hear testimonials from persons living with lymphedema. And I want to share very briefly one story. During the recent workshop in Benin, one young woman shared the story of her struggles of living with lymphedema. And despite the fact that she'd earned a university degree, She's in so much despair that she's at home unemployed. But after coming to this workshop, she said that she felt so empowered by this experience that the next day she was going to go out and relaunch her career. And I'm sure, as Dr. Bakajika and Ms. Safri can attest, there really was not a dry eye in the crowd when she was sharing this story. So after the clinical component, the workshop transitions into exploring more of the programmatic components, particularly as it relates to meeting WHO's requirements. So as part of Module 3A, we go back and review the global program components. As part of 3B, we explore how countries can conduct a situation analysis. For 3C, we look at strategies for conducting patient estimation strategies. As part of 3D, we explore methods and tools available to help countries develop and evaluate their MMDP programs. But with 3E, programs can explore this standardized tool that Dr. King mentioned for assessing quality of lymphedema management services. As part of 3F, they explore the dossier requirements, particularly as it relates to MMDP. And throughout this module, we use group work and case studies so that countries can familiarize themselves with these concepts. And we also do practical exercises that help the countries use their data to fulfill key MMDP components. So I briefly mentioned that there is a country work planning and presentation session. And as part of this country work planning, each country sits down with their data and reviews the current status of their data. Based on what they've learned in the workshop, identify their program gaps, use that to create an MMDP plan, and also brainstorm a little bit about what the key barriers and potential solutions could be. So as you can see in these pictures, each country then presents their plan that they've developed to the group. And it's a really great opportunity for them to get feedback both from the facilitators and from other participating countries. So to date, as Dr. King had mentioned, there have been 3 regional training workshops. This has been a really great opportunity because over these 3 training workshops, these modules have evolved. They've been refined and finalized based on feedback. So in addition to the really wonderful positive feedback that we've received from participants after these workshops, we're incredibly pleased to see that there was an improvement in participant knowledge of key MMDP concepts on our pre and post test. And one other thing I wanted to share briefly with you is that I was really moved by some feedback I received from a support staff member at one of the workshops. And they had told me that they'd never fully appreciated the importance of the LF program until they came to this workshop and heard patient stories. And that really strikes me as how this workshop can be a really powerful tool for advocacy of the LF program. So as Dr. King also mentioned, the development and refinement of this training package has been a huge collaboration. It's been led by WHO, and there's been contributions by all of the dedicated individuals who are listed here. And certainly we'd also want to thank all of the participants from the 3 regional workshops who gave incredibly valuable feedback to help improve this training package. So thank you very much, and if you have more information, you can contact Jonathan King.
Thank you, Caitlin. Thank you for walking us through the development of this package and its different components. Next, I'd like to call on Dr. Suma to present her experience.
Really valuable feedback to help improve this training package. So thank you very much, and if you have more information, you can contact Jonathan King.
Thank you, Caitlin. Thank you for walking us through the development of this package and its different components. Next, I'd like to call on Dr. Suma to present her experience using this training package in Asia. Thank you.
Okay. I would like to share with you the experiences we had by conducting some of these workshops. And Caitlin's presentation has made my story easy. Can I have the next slide, please? So the first of the training was for the participants from Sri Lanka, and there were 5 participants from the anti-filariasis campaign of Sri Lanka who are dealing with the lymphatic filariasis elimination program. And we didn't have a real module at that time, but we knew that what are the topics to be covered during the training. This was a 5-day training program, and we did a pre-test for all the participants just to know what is their basic level of knowledge regarding the LF disease, the program, the patient care, and all the aspects which have already been discussed in the module. And sorry, we also did that. We mainly were focusing on the clinical assessment and the patient interaction, because our research unit in the TD Medical College is a hospital where we come across patients on a daily basis, and this has been running for several years. And we have certain patients who are already on the MMDP program, and they have been experiencing the benefits of the program as well. And so we have brought those patients there, and the participants of the program were asked to interact with the patients and get their own experience, how the disease developed, how it is progressed, what is an acute attack, how suffering was the patients for during the acute attacks. All these were the history was taken by the participants themselves, and then followed by, we have given for 1 day the hands-on training on lymphedema management, how to find out the entry lesion and the washing and the drying, everything what they were doing. But at this workshop, one of the fallacies we have noted was, even though we have discussed about the program aspects like the situation analysis and the patient burden assessment, we thought that it was not effective, it was not adequate. Next slide, please. Then I would like to share with you the lessons learned from this workshop. The first and foremost was that we were feeling that there is a big gap in knowledge among the participants, because there had been a lot of advancements in the knowledge of LF disease, how it starts and the pathogenesis and importance of aerial attacks, all that, and that knowledge was lacking in many of them. And also in the skill to find out the patient, how to care for the patient, those things were also lacking. So we have realized that there is a need for a comprehensive module where there should be different sections dealing with in detail about the background of the GPLF program and how the MMDP program is important and what are the clinical aspects, how we can do the patient care, because this is a neglected tropical disease, and the most neglected part of this tropical disease are the patients. So how we can improve the patients and also the program aspects. And then there was a question, who should be the attendees for such workshops? Because here there were only 5 people, and they were the people working in the program, but usually there should be a lot of clinicians who should be taking care of the patient. Next slide, please. The second workshop was a regional workshop that was for the Southeast Asia region, and there are 8 countries. From the 8 countries, 25 participants were there for the program. Here, before the program, we were trying to modify or work on the modules, and we have developed a more comprehensive modules, and it is divided clearly as Caitlin has already explained. And here also we have done the clinical assessment, patient interaction, and there were group activities for these, the clinical aspects as well as the program aspects. Now, what are the lessons we have learned from this workshop? Next slide, please. So here also we have found that there is a huge gap in the knowledge and skill. So what we were feeling that for this program to be successful, or the patient care should be successful, the background knowledge regarding the disease and why there should be a patient developing the LF clinical disease, how you can tackle that, what are the basic problems, and how you should address the basic problems so that the patients get relieved of their symptoms and they'll have a better quality of life. And here also it is seen that we have done a pre-test and the post-test, and there had been a remarkable improvement in the post-test. And the most important was that realizing that MMDP is sustainable and is extremely useful for patients was a motivation for participants. They said, we are definitely going back and we are going to start doing this. And this realization come from the patient's stories. The patients were telling how they were before they started the MMDP program, how many attacks they were getting in a month, and then how much relieved they are today. And this patient interaction and the hands-on were very much appreciated. The program requirement could be emphasized in this workshop, and that also has taken the participants to do that in a better way in their own countries. And the importance of MMDP for the dossier development also have been stressed on in this workshop. Next slide, please. Now, I move on to another very important workshop, because the WHO envisages that the MMDP program has to be integrated into the primary healthcare system. Even if when the program ends, there will be patients, and so that this has to be continued. The patient care has to be continued. We have in our state of Kerala, we have included the MMDP program in the SDG program, and we thought of developing the MMDP program for the whole state. So from each district, we have 11 districts which are endemic for LF, and from each district we have found out health facilities which can deliver the minimum package of care. We have selected Taluk Hospital because there are physicians and clinicians who will be able to train others in the primary healthcare system, primary health centers or other hospitals. And we have trained 6 batches of 30 Persians each. And many of the participants were not related to the program. They were pure clinicians and nurses, and they were not much involved with the program aspects. So initially when they came in, when we were interacting them, the question was, why should there be a workshop for so many days just for a disease of LF? That is, we had a 5 days workshop. And but we have done all the modules as we have done in the workshop in the CRO program. And here also what we have found is the patient interaction was the real game changer. Next slide, please. So this workshop has helped us again to see that there is a gap in the knowledge and skill regarding LF. And the participants realized that whatever they have learned or whatever they know about the disease and the management or the patient care are not sufficient. And some of them told me that they feel guilty that they couldn't do as much as they should have done for the patients. And this realization was actually from patient stories. And they also realized the usefulness of MMDP and need for regular practice to improve their quality of life. And these patients, the participants came forward to start MMDP clinics in their own hospitals, because they said there are patients coming in, we didn't do exactly what to do for them. We'll give the treatment, some antibiotics and other things when they come with an acute attack, but they were not being advised on how to do the lymphedema management, how to prevent the acute attacks and all that. So they felt that it is a need of the hour that this patient should be taken care of, and there should be an improvement in their quality of life. And here another important thing which happened is the government has also come up with support, and there was some need of some infrastructure development, and some finance was given from the government also. Next slide, please. So with all this training, they have started 51 clinics in the 11 districts, and they're seeing the patients and applying the basic minimum recommended package of care. Next slide, please. So who should get the training? The patient care, it should be all the doctors, nurses, health workers, community workers, and patients and families. They should be trained on this package and what they should do. And also in the district, there are other people like the district program managers, hospital administrators, state program manager, and country focal point. Next slide, please. So the take-home message is that the MMDP with the psychosocial support is achievable, and it definitely improves the quality of life of patients. And with the improvement of the patient themselves become advocates of the program. And the MMDP program would be integrated into the primary healthcare system, and it is sustainable even after the LF program is over. Thank you.
Thank you, Dr. Suma, for presenting your experience in using this training package in the Asian context and the impressive work that has been done there. Next, we have Dr. Bakajika, who will be talking to us about the experience that he's had in the Africa region.
Hello, can you hear me, please?
Yes.
Okay. Okay, thank you very much, Zena. I'll be presenting on different workshops organized within the WHO African region. Next slide, please. So on the next slide, you have 3 main workshops that were organized within the region. The first one was for English-speaking countries, the second for French-speaking countries, and the third one was organized in the Democratic Republic of Congo by the NTD program together with one of the partners. And that meeting was for provincial PC NTD managers supporting NTD's activities in the Democratic Republic of Congo. Next slide, please. What I would like to highlight is the fact that during these 3 workshops, the WHO training package on morbidity management and disability prevention for lymphatic filariasis was used. These 3 workshops were very interactive because patients were allowed to participate, to attend these meetings, and the participants were very enthusiastic and very interactive, and also participants had the opportunity to practice some of the modules of the package. Next slide, please. The first meeting was for English-speaking countries. 6 countries were invited: Ethiopia, the Gambia, Ghana, Nigeria, Uganda, and Tanzania. The meeting was in Dar es Salaam, Tanzania, the first week of September in 2017. Next slide, please. In total, 15 participants from the 6 countries attended the meeting. There were mainly NTD coordinators, LF program managers, LF program officers. As I said earlier, this was a very interactive training. As you can see on this slide, a very interactive session between participants and one of the facilitators. Participants also has the opportunity to interact with patients. And as you can see on the same slide, there is a photo showing the seating arrangement for the practical session. And during this meeting in Tanzania, the LF MMDP training package was updated based on feedback and comments received from participants. Next slide, please. The second meeting organized within the region was for French-speaking countries and 1 Lusophone country. So the meeting happened in Cotonou, the capital city of Benin, the last week of March 2018. 10 Francophone speaking countries: Benin, Burkina Faso, Cameroon, Congo DRC, Congo Brazzaville, Côte d'Ivoire, Mali, Madagascar, Niger, Senegal were invited, plus 1 Lusophone country, Sao Tome and Principe. Very interactive meeting with more than, next slide please, with more than 40 participants, mainly NTD coordinators, LF program managers, LF program officers. We had also participants from the RPRG, participants from WHO country offices, NTD professionals, and also participants from different NGOs supporting NTD's activities, LF activities in some of those countries, like the United Front Against River Blindness and Liverpool School of Tropical Medicine in DRC, and RTI supporting LF activities in Benin. Facilitators were mainly staff from WHO, CDC, HKI, and the University of Notre Dame in Haiti. As key recommendations, countries were advised to start compiling and archiving their LF data. They have been asked to start the preparation of the dossier, which is very, very important in order to be validated as having eliminated lymphatic filariasis as a public health problem, as mentioned by Jonathan. And also countries were asked to finalize the LF MMDP plan developed during the training workshops. As mentioned, so countries were given the opportunity to, as mentioned by Kathleen, countries were given the opportunity to develop their LF MMDP plans based on their data following different presentations. To WHO, to strengthen capacity of NTD programs on LF MMDP, to support countries in the rollout of LF MMDP interventions, to translate the WHO document on the validation of the elimination of LF as a public health problem. This meeting was for Francophone countries, and so far the WHO document on the validation of the elimination of lymphatic filariasis is still in English. So there have been some comments on most of the documents from WHO being first in English and later on translated in French. So as I said also, this meeting was a very interactive meeting, and based on the feedback and comments received from participants, from some of the facilitators, the LF-MMDP training package was further updated based on the lesson learned. Next slide, please. The last meeting organized within the region was in DRC. This was organized by the NTD program together with Liverpool School of Tropical Medicine, one of the the implementing partners of LF activities in the Democratic Republic of Congo. DRC is a big country with more than 2.3 million square kilometers, with 22 provincial PC-NTD programs. So the NTD program at the national level decided to gather all the PC-NTD program managers in Kinshasa the last week of June so that they can be trained on this package. Let me tell you that the Democratic Republic of Congo started with the LF program in 2013. So up to last month, the NTD program managers have never been trained on LF MMDP package. So this was a great opportunity for them to be taught on this very important component of the elimination of lymphatic filariasis. Next slide, please. In total, 35 participants attended this meeting, mainly provincial PC-NTD managers at the provincial level. The meeting was also attended by participants from the UFA and from the Liverpool School of Tropical Medicine. Facilitators were mainly from WHO Country Office, WHO-ESPEN in Afro, LSTM, and the Ministry of Health. As you can see on these slides, I'll be demonstrating on how to assess lymphedema and how to provide lymphedema care to patients with lymphedema. And during this meeting, we had also the opportunity to invite a surgeon, a neurologist, who went through some of the modules of this package. Next slide, please. So based on feedback and comments received from participants during these 3 meetings that were organized within the region, we have been able to learn and we have been able to revise some of the modules of this package. So the revised version of the module will be available very soon on the WHO website. For more information, please kindly contact Dr. Jonathan King. Thank you very much. I'm now available to respond to any question related to the 3 workshops that were organized within the region with the support of all partners, HKI, CDC, Ministries of Health, WHO. Thank you.
Thank you very much, Dr. Bakajika. This was very interesting in tying all of this together for us. I'm afraid we have a little bit of time for questions. We have a few questions that have been posed. Just as a reminder that any unanswered questions will be addressed in writing, and we will be sharing that Q&A document with all of you. Dr. King, I have one question for you from a participant asking if there is a digital platform to share lessons learned on LF MMDP activities.
Thanks for the question. No, at the moment, we do not have a digital platform to share such lessons learned. That's a good idea. It's something that we discussed a little bit. Actually, the GAELF Secretariat had discussed. There was an opportunity to have some platform, perhaps, where there could be some interactive discussion. So maybe we could bring that back up with the GAELF Secretariat.
Dr. MacKenzie, that's on your table then.
Yes, it is, and it's exactly what we're trying to do, is to get a way that we can make sure that programs can communicate between each other and with us for help. So yes, it's on our plate. Thank you.
Thank you. And then I have another question, Dr. Suma, for you. The question is, does anyone target early detection of hydrocele and lymphedema among adolescents? Because it appears that usually we wait for adults and then it's more complicated cases.
We focus mostly on the grade 1 and grade 2 lymphedema, and it is always good that you find out the grade 1 and grade 2 lymphedema. But for that you have to create an awareness among the people that there is a treatment available for the lymphedema, so that they'll come to the hospital or to a clinician or to somebody, so that we can pick up early cases. Because by doing the MMDP program as well as applying other things, it has been found that the lymphedema is reversible usually in the grade 1 and grade 2, or else it may not be advancing. So it's even in the grade 3 lymphedema, there could be reversal of the lymphedema, marked reversal of the lymphedema. So always it is good that the early stages should be detected. Another point I want to stress is that about children, which Dr. MacKenzie also has suggested. So even in one suggestion was that in children at the endemic areas, we should start the MMDP, like the cleaning of the limb, the hygiene practices, and the other things for the lymphedema management should be started at an early stage itself, so that even if they have pathology in them, they will not go in for a later stages of lymphedema. So it is always, we have to find out the early cases of lymphedema. Thank you.
Thank you, Dr. Suma. And we are going over time. We have one last quick question that we might be able to answer. Dr. MacKenzie, this one is for you. Can you say something about the rationale of the cross-cutting approaches with other skin-related NTDs such as leprosy and Worrell ulcer in MMDP and the related aspects of care?
Yes, thank you. This is a good question. And this really brings me back to the health worker, who is really the one at the field level who can provide long-term care for patients. And certainly training up, empowering health workers to understand all of the sorts of skin diseases, leprosy, podoconiosis, LF, giving them the power to provide care. So, and on the programmatic side, we need to get together as programs, leprosy and LF, podoconiosis and LF, and work out ways of doing things together. So it's an important method of getting care to people with skin disease. So thank you for the question.
Thank you, Dr. MacKenzie. I'm afraid we're out of time. We wanted to thank you all again for participating in this webinar. As discussed before, all of the PowerPoint presentations and the recording of this webinar will be shared with all participants, as well as a Q&A document answering all the questions that you've posed and we did not have time to answer today. I wanted to thank all of the presenters, as well as my fellow organizers, and I hope to see you again on another one of our technical updates. Have a good rest of your day, everybody.
Thank you.
Thank you.